Good afternoon and welcome to World Health SocialGood's coverage of the 68th World Health Assembly. The show is brought to you by the United Nations Foundation and WHO in order to ensure that you have a voice in the important discussions that are going on here with the major health issues of today. Now today is the first of 9 hectic days. Well, before we dive into all the details of it, I'll let you take a look behind the scenes so you can see how the World Health Assembly comes together. Here at the United Nations in Geneva, Switzerland, we're getting ready for the World Health Assembly, which starts tomorrow morning right here in this hall. We could have up to 3,000 people walking these halls and running between meetings, and that's why we came in on a Sunday to show you around. So we're in the Assembly Hall here now at the United Nations. This is where it all begins. Galdens, what's going to happen here tomorrow?
WHO has 194 member states, and each of them is coming with a delegation, often led by the Minister of Health. And then it's the minister or one of the delegate or somebody from the mission here in Geneva who is sitting in here to follow the debate in the General Assembly.
And it should be said that for about 9 years, Galdens was sitting behind the name Switzerland as the Swiss delegate for health and also as the ambassador for global health. There are several layers of balconies here. Media will be up here, NGOs will be up here. Public can come to some of these. Some WHO staff will be sitting here. So, this is now where a lot of the work happens. We're a couple of buildings over from where we started. What's going on over here during the week?
Actually, in the Health Assembly, in the plenary hall where we have just been, it's the formalities. The real work starts when delegations split into Committee A over here and Committee B over here. Committee A deals with all the technical matters, all the health matters WHO is dealing with. Committee B deals with the financial and administrative matters. If they realize that the discussion in the committee would be too cumbersome and too complex, they often create a drafting group. That means an informal group, no observers, no NGO, no press, where member states amongst each other can hammer out a compromise.
All right, Galdens, this is about the emptiest I think I have ever seen the Serpentine Bar. How about you? See, this is the fun part about coming on a Sunday.
When you're at 4 in the morning, you find it empty again. When you get out of the drafting group over there, you find it empty. But otherwise,
but do they still
full.
serve you coffee?
No.
And people trying to find chairs to have discussions and make work, no?
It's not only finding chairs, it's also you see somebody you want to speak with, but they are speaking with somebody, so you don't want to crush in, but you are close enough that they see that you want to speak with them.
You can tell where the policy is moving to by who is sitting with whom, right?
You see who is sitting with whom, who is happy, who is tired. Observe people, which is also important in the room. Teaching health diplomacy, I sometimes speak of reading the room.
So every country and the Secretariat has a nameplate. It's more than just saying who you are, right? How does it work? How does the flag work?
First, it says who you are, and it's always funny to find the countries because they are in alphabetic order. When you want to speak, you simply take the nameplate and put it up. But then you have to watch of who is...
It's never that easy.
Then you have to watch who is going first, because sometimes you want to intervene very first. Sometimes you want others to speak before you, because you can answer. Usually you get only one go. There is one exception. If you make like this, you ask for what is called a point of order. A point of order means only procedural issues. You can bring something immediately to a vote by a point of order. You can ask the legal counsel to clarify a legal question, but you can't make your policy point with a point of order. There you have to wait, and sometimes there are 50, 70 flags up. You have in front a traffic light.
Now, they don't turn off the microphone when it goes to red. This is just good behavior, right?
Depending on the chair.
Is there good peer pressure, yeah?
It's peer pressure, but many of the chairs have actually really intervened and said, please come to a close. And when the chair tells you, now you really have to come to a close, it starts to get embarrassing. Actually, it's a back and forth during the whole week of the assembly, because the work is done in the committees, but only the plenary can give the final approval to any decision. So the president of the assembly has to often only chair over formalities, but sometimes getting into the real political issues and be ready for it.
All right, Gaudenz, I'm going to let you go because I know you have to run across town and do some more meetings. That is the scene the day before the World Health Assembly. The work has already started in Geneva. Thanks so much for coming by.
Thank you, Christy.
Really, it was great to see you, and thanks for giving us a tour of everything that's going on here. And you know, it was a lot of fun running through the hallways of the Palais on a Sunday afternoon with Gaudenz, but now we've got to get down to some real work here. Joining me now is the Senior Communications Director from the UN Foundation, and that's Eric Porterfield. Eric, thanks for coming by. He and his team are really the mastermind behind the plus social good concept. It wasn't that long ago that if you came to, if you wanted to be a part of the World Health Assembly, you had to come to Geneva in May. And last year, Eric Porterfield and his team changed that and brought us plus social good. So we did the first World Health plus social good then, now we get to do it again. But you do this for a lot of topics, not just health, right?
That's right. It stems from our Social Good Summit. That's an annual event in New York alongside the UN General Assembly. And it was created more than 5 years ago to really break down the walls of some of these big convenings to give everyone a voice and a chance to hear what's going on and impact some of the decisions being made.
How much contribution do you get from people during these sessions, and who's engaging?
So we have we've done 350 events in the last couple of years, from places like Davos, which is only a few miles away, to the base camp of Everest, where people were talking about the importance of water and sanitation. We've had, last year at the World Health plus Social Good, we had more than 10,000 viewers with more than 1,000 comments and questions. And those questions came from around the world. Yeah, go ahead.
Why do you think these types of engagements are so important? Why is it important that people get an opportunity to have a voice in a global conversation?
So I think it's because the experts here making policy decisions and having discussions, those decisions impact everyone everywhere. So it's important for a level of transparency, for people to really have their say, to know what their leaders are saying, and to have a voice, and to really hold their governments and their leaders accountable.
Eric, thanks for coming by and joining us, and thanks for bringing the team out to help us bring the World Health Assembly to more people.
It's a pleasure.
Appreciate it.
Thank you.
So the first day is well underway here at the World Health Assembly. Arriving this morning, we saw German Chancellor Angela Merkel. She gave the keynote address this morning, and she spoke to the importance of health into the sustainable development idea. She touched on things that she said were really the important health focus of the G7. Germany has the presidency right now. And she talked specifically about neglected tropical diseases, antimicrobial resistance, and the importance of a global plan being worked on here to preserve the existing antibiotics that we do have. She spoke also to the importance of WHO reforming quickly so that we can respond to large-scale emergencies better in the future. Here she is arriving in this video. I'll let you watch this for a moment. That's Dr. Chan, the Director General of the World Health Organization, that's with her there. It was Angela Merkel that kicked off the World Health Assembly this morning. She had the keynote address that started us first thing. Here you see them walking to the plenary room, and that's where she is now. She's up on the stage, and she's taking the stage to make her comments.
Die Anstrengungen sind so wichtig, dass jede helfende Hand gebraucht wird. Und deshalb zum Schluss noch einmal.
The plenary hall that you see there holds several thousand people. As you heard in the clip just a moment ago, it is the reason that we come down the hill for the World Health Assembly. We don't have any space up at the World Health Organization that could hold a crowd of this size. You can't tell it there, but there you can. The level of balconies in this assembly hall. That's the president of the World Health Assembly there.
The Ebola outbreak
And there you get a nice shot of the room. Here you see Dr. Margaret Chan, the Director General, giving her opening comments. In the speech, she committed to building an organization to lead the response of outbreaks and other health emergencies. And she spoke to some of the specific changes that she was planning to do, such as creating a single unit that cuts across the organization for health emergencies, uniting all of those resources that we have. She also mentioned the development of global health workforce and a contingency fund that could cover the immediate costs in those initial first days of a response. She mentioned too, just like the German Chancellor, the concern of antimicrobial resistance and what that means to public health. Now in the plenary room behind me, this is still going on, and the member states are actually now responding to her speech and to the comments she made. The topic of their conversation is building resilient health systems. This is something that's really the root of the safety net in countries in order to make sure that countries can catch disease outbreaks early, that they have the capacity to respond, and that we can also help them with their response. But now I want to start with a very quick roundtable just to whet your appetite a little bit with some of the topics that we have coming up here. I promise you we will go deeper with all of these folks later, but really I'm just trying to get you interested in this. I have 4 people joining me here. Here in the beautiful green suit is Dr. Flavia Bustro. She is the Assistant Director General of our work on maternal and child health. I have Dr. Charles Penn, who is leading our work on antimicrobial resistance, and this is where the antibiotic resistance falls in. I've got Dr. Rick Brennan here, who has been the director in charge of our Ebola response, and Dr. Maria Nera, who is the director of our work on climate and health. All of you very busy right now. I'm going to not even let you get comfortable in your chair. I'm going to ask each of you one question and get you to just tick through it. Flavia, let me start with you. What is the big work you have coming up this week? What are people going to be hearing about?
So we begin this evening with a very special event on the new global strategy for women, children and adolescent health, which the Secretary General of the United Nations has begun the development of. And we have a number of ministers from India, from South Africa with us discussing that. And across the week, we have a number of items that will discuss women's health status, adolescent health status, the very important aspects of immunization and the progress on the Global Vaccine Action Plan. So stay tuned. This week will be very strong on women, children, and also on the link and the impact that the environment has on their health.
Super. Charles, just pass the microphone over to Charles there. What's your week look like? What are the hot topics there? We've already heard both of the big speeches this morning mention antimicrobial resistance. So tell everybody what's coming up this week.
Okay. So this week, all the member states here will be considering and asked to adopt a global action plan for addressing antimicrobial resistance. And the importance, the significance of this right now is antibiotics and other anti-infective medicines have been one of the most important advances in medicine of the last century, helping us to treat infectious diseases, making other medical advances such as surgery and cancer treatments safer and more possible. But we're losing the effect of these medicines. The more we use them, the more the microbes adapt to overcome them. So people are spending longer in hospital, diseases are becoming untreatable, other medical practices put at risk, and if we don't do something about it, it will get worse, and that's what's being discussed this week.
Terrific. It's going to be a busy week for both of you. Rick, how about you?
Well, as you might imagine, Ebola is a big topic this week, but not in isolation. We're going to link all the discussions around Ebola about what we need to do moving forward to improve our emergency operations generally. And we kick off tomorrow with a technical briefing at 12:30, at which we'll have representatives from the 3 most affected countries by Ebola, Sierra Leone, Liberia, and Guinea. We'll have representatives from their ministries of health, as well as other experts talking about what it's going to take us to get to 0 Ebola cases in West Africa and what we need to do to stay there. Then we'll have 2 big sessions, both on Tuesday afternoon and Wednesday afternoon. And what they'll be addressing is some directives given to the organization by our executive board back in January. You may know that we had a special session on Ebola in January. The executive board requested several reports, and those reports will be presented over Tuesday afternoon and Wednesday afternoon. And again, they'll address the current status of the Ebola outbreak, what we need to do to extinguish the outbreak, and then what the world needs from WHO moving forward to ensure that we have strengthened emergency preparedness and response capacities, not only within the organization, but also globally moving forward.
Maria?
Well, 2015 is a very busy year for the environment. As you know, in Paris in December, we will have the Climate Change Summit. Hopefully, the countries will take decisions that are the right ones, because then we will have a great opportunity to tackle and to climate change, but at the same time to produce a lot of benefits for human health. We will have a technical briefing on Wednesday where the countries will be discussing again how climate change is affecting our health. Climate change is a major threat for us, for our health, but it can be transformed on a good opportunity if we move in a more sustainable development, better transport system, more sustainable, reducing air pollutants. And we hope that this will be the very strong arguments that the ministers of health will take back with them to capitals, and then influencing a little bit the discussions that will take place in Paris. And then on Friday, the countries will start to discuss a resolution on air pollution and health. And as you know, we have more than 7 million deaths every year caused by exposure to air pollution. So for us, this is a major, major public health challenge. And again, we are looking for ways of transforming this on opportunities for public health.
Thank you, Maria. Thanks, all of you.
And in addition to this fantastic summary
you
do, what we also would like to welcome people to follow us on Twitter and on the social media, so they can be up to date with the statement and the comments that all the distinguished delegates are making. So follow us.
Now, you know, Flavia could not have given us a better segue at that point, because thank you all for coming by. I will let you get back to work, even though questions are arriving from our viewers, but they will ask you questions in depth a little bit later in the show this week, whenever we have you back to go really in depth. Flavia's segue was perfect because this is a digital platform, and the idea is that you engage in these conversations and you get access to our experts as we're going along. We're set up here in the big hallway so that we can snag some of the best experts as they come by. What we'll let you do is, hold that, Madison, thank you. What we'll let you do is ask questions on Twitter. There's two different ways you can do that. Hashtag SocialGood and hashtag WHA68. The idea is you send in your question, we ask the experts, and that way you get to participate in the conversation as well. Now, because this is a digital platform, we will be bringing you every day our digital team. And Sari Setiogi, you're too far from the table, come on up. Sari Setiogi is the manager of our social media team, and she will be leading our coverage there. And we also have this year a group of journalists, 5 journalists that have come to the World Health Assembly. I think it's all of their first time, and they are attending the entire sessions. And because they are here, and because it was the UN Foundation that brought them here, we're bringing one of them on the set every day to talk to us also about what the buzz is in the media circles. So I've got Sari Setiogi here first. Sari, let me start with you. What kind of interest are you seeing in the World Health Assembly online, on social media this year?
Yeah, I think it's been very fascinating because as of this morning, around 9:30, we actually see the hashtag WHA68 was trending in Switzerland already. And we're seeing also for speech from Merkel, and also DG address was also very popular on Twitter so far.
And now that the United States is awake, we're expecting the United States to catch up with Switzerland and start trending hashtag WHA68 there. Let me also ask you, what do you think is the reason that we're having an increase in activity this year?
Yeah, so far in the last 24 hours, we are seeing around 11,000 tweets with hashtag WHA68, and about 8,000 in the last day. And I think it's probably because the live webcast that we did for the very first time this year, and also the WHA68 app.
So we're webcasting for the first time, and we have a new app. For the first time.
That's correct.
Very good. Sorry, stay close for just a second. I'm going to turn now to Madison Park from CNN.com. This is your first World Health Assembly, isn't it?
Yes.
What do you think?
It's been great. I've seen such a great, diverse bunch of experts, as well as so many interesting health topics to discuss, that it's almost overwhelming, and you just kind of wish there was more time to get to talk to people and learn more about different topics.
And what do you hear in the media circles are the most interesting topics for today? What are people filing on?
You know, I think definitely Ebola is the big news of the day, and especially it's been going on for such a long time, and people want to see how the WHO will reform and what lessons we can learn from it. So I definitely see Ebola and a lot of attention being paid to that.
And as Flavia was just mentioning a moment ago, we do have our resolutions covered on our Twitter account. Sorry, tell everybody how they can keep up with the latest news as it's happening here at the Assembly.
Yeah, on Twitter you can follow at WHO, and the hashtag is hashtag WHA68. On Facebook it's facebook.com/WHO, and on Instagram it's at World Health Organization.
All right. We'll see you tomorrow, and we'll have another journalist from the Fellows tomorrow. Thank you both for coming by.
Thank you.
Now, we've told you a bit about the Assembly, how it's set up with Committee A and Committee B. We showed you about the drafting groups. What we didn't tell you about in that video earlier was the technical briefings. Now, the technical briefings occur at lunchtime every day, Monday through Friday and next Monday. They're a bit different from the hundreds of side events that are happening throughout the Assembly. The technical briefings are really a bit special. They focus on specific topics that are of interest, and I think everybody that was sitting around this table a little bit ago for the opening segment, the rapid roundtable, is going to have a technical briefing. So it is the major focuses. Today we already had one, and it was about the post-2015 Sustainable Development Goals. Now, there are two pieces to this. Our first guests are sitting down, but I get to talk a little bit longer. There are two pieces to this. First, there was the Millennium Development Goals. So they were started in 2000, and they were to carry us through 15 years of progress so that countries were working together toward common goals to help guide global efforts to end poverty. Joining me now to talk about this piece of it is Dr. Thies Broma, who is the Director of the Department of Measurement and Health Information Systems here at WHO. You noticed I had to read that, right? All it means is he's very smart, okay? We also have Dr. Ariel Pablos Mendez. He's Assistant Administrator for Global Health at USAID. Thies, let me start with you. The MDGs have been good for public health by all accounts. And recently the Director General said, and I quote, "They have focused political attention and generated badly needed funds for many important public health challenges." Talk about that for me.
Okay, so maybe it's good to take stock now. We're in 2015 of the MDGs. Where did it bring us in the past few decades? So in 2000, targets were set for 2015 for a few health goals. Child mortality, maternal mortality, and infectious diseases. We're not quite at the end of 2015, but we got a pretty good picture of where we are. And we've just published the World Health Statistics 2015 to take stock. So just a few highlights, because first of all, I think we should keep in mind that the progress has been spectacular. We did not meet all the targets, but it's been spectacular. Child mortality was cut by half since 1990, from 90 to 46 per thousand. That's an enormous reduction, has never ever happened in history. Pneumonia, diarrhea, measles, malaria, dramatic reductions. It didn't meet the target. The target was 2/3 reduction. Maternal mortality also cut in half. Dramatic reductions in the numbers, but still 300,000 women dying every year from complications at delivery and after delivery. The target was 3/4 reduction, so we didn't meet the target, but an unprecedented decline. Then the infectious diseases, HIV, TB, and malaria. The goal was to turn around the epidemic by 2015, meaning that the new cases should have gone down from what it was in the past. It did for all three diseases. For instance, for HIV, the peak was around 2001. Now we're much lower but still 2.1 million new infections every year. So in terms of the MDGs, they've generated enormous momentum around these goals, and everybody has been following progress towards these goals in countries, regionally and globally. So in that sense, the MDGs were a big success.
If you have any questions for Tees or for Ariel while they're sitting here, go ahead and send them in through Twitter. It's #SocialGood or #WHA68, and we'll go ahead and ask those questions for you. Let me ask one follow-up question on that. You said in some cases the targets weren't met. Was this a case where the targets were overly ambitious to try to make progress, or were there other challenges?
Well, the targets were ambitious, definitely, and I think that's been good because they really drove the international community first and then also countries to do the maximum possible. Many countries met the targets for many indicators, and that's great. Other countries had other situations like fragile states or lack of economic progress or poor decisions on health policies that didn't lead to the success that we were anticipating. I think there's one other thing that I must highlight. The MDG agendas did not have equity very clear in it, so focus on the poorest. It was very much focused on national progress. I think if we look forward, we really need to address that issue, that equity needs to be very central and we focus on those that are suffering most.
Ariel, let me come to you now. You'll need to pass him your microphone. Give me some examples now. Let's go to more of a global picture here. Give me some examples of what the global community has been able to achieve because of the MDG accomplishments.
Well, thank you very much. And I join Tees in the assessment that the gains in the last 20 years have been spectacular. Whether it's the #1 MDG of cutting poverty in half, it has happened already before, ahead of time. And half the worlds that were low income in the year 2000 have now moved up to middle income. And that is a marker for the whole of the development success of the last 20 years, which is important for health as well.
And you attribute that to the MDG work?
Well, clearly, what the MDGs is, it's the first time we had in history a consensus, a soft consensus, because it was technically grounded, but it was not directed, right? It was an aspiration, an ambition that is almost like an open source music, right? Nobody was truly dictating or holding your hand. It was, this is the music we want to see in the world, and the world, NGOs, private sector, governments, foundations, bilateral donors, agencies, everybody moved in their direction without anybody controlling it. It's quite an
nice
impressive thing.
Yeah.
But indeed, it brought the world with a single consciousness. I remember that when the men went to the moon and they took the first photos of planet Earth, and they appeared in the magazine, the Almanac in the United States, it gave you a sense that we were all in it together. And I think the MDGs gave us that in development. So because of that, we have made many of the points that Tees has made. We have cut in half maternal mortality, cut in half HIV infection, cut in half pretty much child mortality. And it's an area that, because of the success and the speed, you will imagine it gets harder, right? If you, the lowest hanging fruit, it gets harder and harder. Well, the rate of decline in child mortality is accelerating. Compared to about 2% per year annually decline, we now have almost 4% per year in the world. This is quite an impressive story. I believe that family planning has been very, very important as well. Family planning not only helps save lives of mothers and children, it empowers women, and it does a lot of good things for health and development, and then it brings a demographic dividend as well that has contributed to the economic improvement. So the economic improvement has come from many forces, but clearly the demographic dividend, thanks to family planning, has been also quite crucial.
I want to ask both of you, did the accomplishments made through the Millennium Development Goals exceed your expectations at the beginning? Ariel, since you have the microphone, you can start.
No doubt. When USAID was established just over 50 years ago, there were nearly 20 million children dying every year. 20 million, right? Or thereabouts. The world has double or triple in size, and the number of kids dying by 1990 came down to 12 million, now around 6 million. The success that we have seen in our generation, in our lifetime, has now emboldened us to see what we see as a grand convergence, that the levels of mortality in the world will now approximate those enjoyed in the richer world. That will mean that although there will still be some deaths, because we have deaths even in rich countries, the deaths should be less than 2% in a world that gives about 130 million births a year. That would still mean 2 million deaths, not zero. But that is our goal, the goal of to end preventable child and maternal death by 2030 means this grand convergence of the levels of mortality with the richer world, and it's already happening. We're almost 80% of the way there, or 90% of the way. We will end preventable child and maternal death in our generation.
It's hard to believe, isn't it? Ties, what about you?
Well, I take it from the numbers perspective, because that's my job and passion. So every time a country does a national survey, a demographic health survey, I open the report and the first page I look at is the child mortality decline. And every time I was surprised, whether it was DR Congo or Ethiopia or any other country, about the enormous declines in child mortality. It was just so striking. So in that sense, I have to admit, I was really surprised. I think we've also seen quite a large growth in funding that went into key health interventions for child, maternal, and the infectious diseases in countries. And so what it tells us also is that more money can make a difference. And I think that's this can-do lesson I think we have to take forward. So it's in 2000, I would not have thought that we would be in this place now.
Yeah. Ariel, let me ask another question to you. Where does the focus need to be now? Finishing this in 2015, plus also looking forward. Where does the focus need to go?
Well, obviously you like the idea of ending preventable child and maternal death, so we're going to do that. And we also have to continue to contain infectious diseases, both the classical and also emerging pathogens. The world is looking at non-communicable diseases and injuries, which is one of the few causes of death, age-adjusted, that is growing in the world. But importantly, as we see the end of preventable child and maternal death, a grand convergence, that would be, if you think of it, in terms of inequality between countries, that will mean the end of those between countries inequalities. But within countries, there will be a lot of inequalities, both on the income part and in many of the health indicators. So we see also a within-country revolution in the future, both to address the inequalities in health and as well as mobilizing domestic resources rather than dependence on international assistance to get this done. So one of the aspirations in the post-2015 era is universal health coverage. Make sure that the bottom half of the population have access to essential services, and that people do not have to go broke because they have to pay for health in the world. That's an aspiration that we can deliver, and given what we have done so far, we feel very confident. Because the economics of countries are improving in many of the countries, we also see the need to reorganize the financing in a better way and to bring in new ideas as to how we're going to finance health in the future. In the countries that still need for that grand convergence to occur, ideas like the global financing facility for every woman, every child will be important and part of the new post-2015 era.
You know, I'm going to have T stay with me in just a moment. He'll be here for 2 blocks from now, but I'm going to lose you, so I want to ask you one more question. You just mentioned the idea of financing these types of investments. How do you do that? How do you ensure that you've got the investment that you need in these types, in the work that brings us to these types of goals?
Well, clearly results is a good thing, right?
Yeah.
In a way, we are moving from an era of death to an era of life. We were before just painting picture of the dying kids, and now we're showing you we can end preventable child and maternal death. That's possible. And it's going to be about thriving and surviving. Now, to do so, also the economics will change. While the international community remains quite generous, and the American people has been one of the leaders in investment really in many of these areas, we expect countries to do more. And so we are looking at the economics of countries, their GDPs growth, their taxation, their total expenditure, what public, what private, and how we can bring together resources locally to address these needs. Domestic resource mobilization and transparency will become fundamental to financing health and development in the post-2015 era. And ideas, for example, in the year 2000, many of the poor countries were drowning in debt, and their societies were collapsing because of AIDS in Africa. Now Africa is one of the fastest growing regions in the world. They can now see their financial growth and their economics growth, and you see, hey, could we not borrow from that future to save lives today? And the answer is yes. So we are creating mechanisms that will allow us to borrow from the future to address needs today, country-owned, country half owned by the countries, half paid by the international community, bringing private capital to all sort of innovations in financing. And indeed, at the end is organizing all of in a way that will be sustainable and fair.
Tees, let me ask you one follow-up question. We're going to get into the financing aspect of it a little bit more in your next segment. It's not right after this, it's two from here. So we'll dig deeper then, but I'm curious from your point of view, both of you have mentioned the need to focus on finishing the commitments that we've made here and keeping this moving forward, sustaining this. What would you say of the 8 current goals in the Millennium Development Goals, what would you say is the one that needs the biggest push still? Perhaps it's made the least amount of progress, perhaps it has the most to gain. You can pick the reasoning why, but what is the one you would say we absolutely need to put a full court press on?
Well, if I go by the annual discussions that we have in the World Health Assembly here, the topic that always stands out is maternal mortality, which is MDG 5, where we know the interventions are there, where we know it can be done, but still 300,000 or so women die every year. And that is unacceptable, and that is a priority. Now, there is some good news here, and I think that the post-2015 agenda can capitalize on that. In the last few years, look, me opening these reports about how many women are delivering in facilities. For the first time in decades, more women are delivering in health facilities in almost every country that I've seen, which is really a big achievement because it's stagnated for decades. Now the challenge is to deliver the quality care to those women and make sure that they are there in time. So I would pick maternal mortality reduction as my number 1.
You like how I didn't ask you that question? But you're going in.
It's a great question. And we actually have been looking at each of the priority countries which USAID supports, about 24 of them. And there's a tool, a Johns Hopkins tool based on data that Tees and others put together called the Life-Saving Tool, which allows you to calculate. If you put $1, where will that give you the most bang?
Oh, really?
What is the most feasible based on what other countries in your region and income status have accomplished? What is possible, and how much does it cost to reach that optimal status? And when we did that across our countries, lots of things are important, as this has mentioned here. Many vaccines and everything is important. But the one thing that jumps every time is investment in family planning. It jumps every time. Family planning alone could help prevent 30% of the maternal deaths, 25% of the child deaths, empowers women, that allows to improve health for the rest of the family and the communities. And as I mentioned before, it brings on a demographic dividend of 2% of GDP growth compounded over 20 or 30 years. So, but even just based on the life saved part of those 3 big outcomes for family planning, it comes ahead as one of the most important things we are doing, and the world needs to do obviously more across everything. But if you're asking one thing that will yield the most, the models are very, very clear actually.
All right, thank you both for joining us.
Thank you.
Errol, I'm going to let you go. Tees, I'm going to let you slip off the set, but I'm going to ask you to stay close. I'll take that. Thank you very much. Good to see you. Now remember, I told you there were 2 parts to this discussion. That was a very interesting wrap of 2000 to 2015, right? We learned a lot, we made a lot of progress. It was hugely successful by all accounts. There's your microphone, thank you. Now, remember there's 2 parts though. I told you the Millennium Development Goals went until 2015. Well, it's 2015. So part 2 of this is let's take a look at what we've achieved, and then let's decide how we go forward. What are we going to do for the next 15 years? Obviously, we at WHO are very interested in the health aspects of this, but we all recognize that health does not exist in a silo, that all development goals work together. Joining me now to talk about where we are going with the next set of development goals is Amina Mohammed. She is the Secretary General's Special Advisor on the post-2015 development planning. Thank you for coming by. It's a pleasure to have you here.
Yeah.
So we're at 2015 now, and we're taking a look at going forward. Tell me about the process. You are literally leading this process for the Secretary General. How do you decide what are going to be the development goals for the next 15 years? How does that work?
Well, member states decide, but we try to help inform that with the best possible lessons learned and evidence that's available for what we need to do to respond to the challenges that we have today. They're not the challenges of 2000 when we designed the Millennium Development Goals. There's a different set of challenges. Some are still existing because the MDGs are unfinished business, but there are new ones. It's a new narrative that we have to respond to, where conflict is a very big issue, inequality is huge, young people that don't have jobs, the lack of access really just to basic services and rights. So we're really looking to see how to help member states in a universal agenda, because this is so much bigger than we had before. One, how do they bring their priorities in? How do we help shape those where we can agree the ambition to a response in a set of goals and targets? And that's taken a long time, and it's one that we've learned that ownership is key from the country level within different stakeholders and their constituencies, and how to make that a global conversation and bring that into negotiations, which are pretty difficult.
If you have any questions for Amina, then you can send them in to hashtag WHA68 or hashtag SocialGood. We have one question here. When the blue circle comes up here, it means we have a question from somebody that's watching us online. So the question is, how do we address health equality, the inequality issues?
Yeah, I mean, the inequality itself has different dimensions to it. The policy environment has to be key to that, the coherence of it within what we aspire to globally, but also local result. And then we've really got to see how we put in place the priorities of a country for access to everyone, and what are the missing pieces to allowing everyone access to basic services, particularly health. But as you know, with the SDGs, we also talk about education, we talk about gender, we also speak about ending poverty and making sure that there is social inclusion on the inequality agenda.
Do you find consistencies to the barriers to access?
I think across the world there have been. Clearly, you know, women are our one consistency all the way through, that we see barriers to that. But I think institutionally, policies themselves are not conducive. They don't look through a gender lens often. And we also see that many vulnerable groups are left behind. And some of the tools available to make that not so should be what is at the fore of the agenda today. So we talk a lot about accountability, strong institutions, the data revolution. If we're leaving no one behind, which is key to this universal agenda, what are we doing about the baselines and really trying to disaggregate them, not just by country, within country, across countries, to see, you know, where are those that are missing that need to be brought to the fore.
I'm curious how the process to develop the next 15 years of goals has differed from the process to build the goals for the Millennium Development Goals. What have we learned from putting together the MDGs that's going to make the process even better for the SDGs?
I think the ownership part of this, the involvement in a process to determine your priorities as a country, as a constituency in civil society, parliamentarians, business, vulnerable groups that were not always captured by some of the stakeholder groups. In 2000, it really was an acknowledgement that the many different UN platforms had not met the goals they had set. So for instance, on the education for all, the health for all, many goals were left behind, and it was sort of, what can we do as the minimum ask to actually put forward an agenda of 8 goals, as it turned out, a Millennium Declaration that says these 8 goals must be achieved within 15 years. That was basically done by a lot of experts who were committed to this and who had the experience of many decades, but it was done in a closed environment, and so regarded and referred to as a prescription.
Okay.
Coming down to our countries, and I certainly was a part of a very big country that received the MDGs, took us a long time to understand and to own them and to integrate them into our own investment plans. That's a big lesson learned. And so in this sense, the interaction with governments and with stakeholders right from the beginning, a 3-year process, as wide as possible, the involvement of young people, especially women, across social media who are informing this, gives us ambition. It gives us a sense of can-do, because we have to do it. The implications for not are too dire. But it also has broadened the need to bring in all aspects, so we don't just talk about the substance, we also talk about the means of implementation, and we talk about accountability.
I have one last question for you, and I'll ask it briefly so we can finish on time, but there's 3 major events over the next 6 months. We've got the Financing for Development, we've got the report of the progress of the Millennium Development Goals, and we have the Climate Summit. They can look like from afar that they are completely disconnected, but actually they're quite interconnected, aren't they?
Very interconnected. One without the other just won't give us the ambition we need to respond to these huge complexities we have in the world today. The first meeting, which is the means of implementation, really does, in July in Addis Ababa, does try to respond to the 17 goals that we have, the substance of the SDG framework. And that is very important because it opens up the resources in a much broader way, brings in technologies and capacities. So we're going beyond just speaking about what we've done before, unlocking resources that were not otherwise available to the development agenda. These messages and what happens with the ambition have a direct impact on what we do on climate change. And that we have to bend the curve to make it a better world. And I think that these are 3 things that we can do. They're within reach. There's certainly the wherewithal. What we need is not just the political leadership, but we need commitment and we need courage of conviction.
Amina Mohammed, thank you so much.
Welcome.
She is leading this work to develop the SDGs for the Secretary General. Really a luxury to have her here with us for just a segment. Thank you so much for your time. We appreciate you coming by.
Okay.
Now, as I was saying, the technical briefings really give us a great opportunity. You know, this is the part of the day where you have all of the experts on one issue coming together. And when they come together, we can really have a full all aspects of a conversation together, and it gives you an opportunity to jump right in the middle here. You can ask your questions on Twitter. You can reach us at hashtag WHA68 and hashtag SocialGood. Now, don't mind us here as we're moving chairs around. We're part-time furniture movers at the World Health SocialGood. And I think this is going to work to get everybody around the table. Like I said, the benefit of the technical briefing is that we can grab all of the experts. And I certainly have some of the best here around the table. I have Dr. Tim Evans, who is the Senior Director for Health, Nutrition, and Population, the Global Practice at the World Bank. And we will give him the tough question that just came in. We have Dr. Tees Vorma, the Director, here we go again, the smart man, Department of Measurement and Health Information Systems at the World Health Organization. It's quite a title, isn't it? Yeah. World Health Organization. That's the easy part of his title. And then we have Faraday Luiga. Am I saying that right? Help me out. Where's your microphone? Help me out here.
Farida Luiga.
Thank you very much, from the White Ribbon Alliance. So send your questions into these guys, hashtag WHA68, hashtag SocialGood, and we're going to start by asking Tim Evans a very difficult question here. And that is, a blue circle means a question from Twitter. What is meant by sustainability in health?
Do I use the microphone?
Yes, please.
Okay. Well, sustainability in health is a tricky complex in the sense of the physiological dimensions of sustainability, but those are all the things that you need to keep healthy. And if you think of those relate to food, those relate to shelter, those relate to access to healthcare when you're sick, right? And if all of those elements are in place, then over the course of your lifespan, you're likely to be able to sustain your health. So sustainability really is a reference to those factors, those prerequisites, those foundations, those services that every person would need to access across the course of their life in order to enjoy the highest attainable standard of health.
All right, thank you. That was very helpful. Tees, let me come back to you. You were here just a moment ago, and we were talking about the Millennium Development Goals. Millennium Development Goals, we had 8, if I remember correctly. Nearly half of them probably involved health. What are we looking at now for the next 15 years with the SDGs? What are we looking at for the health piece of that?
So the proposal from the so-called Open Working Group, which was discussed in the UN General Assembly last year and pretty much accepted, so it will now move into the outcome document, which will be discussed in September for adoption in the UN General Assembly, has 17 goals. 17 goals, and one of those is a health goal. And then under each goal there are targets. In total there are 169 targets, and 13 of those are health. So in terms of the prominence of health, you would say it's less prominent than before. It's also important that the new agenda, whereas the MDGs were very much focused on poverty, improving health, education, this new SDG agenda is about all countries. So it's an all-country agenda, and it addresses the economic, the social and environmental issues. So that's why perhaps health is less prominent as a goal, one goal, but health is in all other goals as well, as a contributor and also as a beneficiary. So in education, nutrition, poverty reduction, climate change, equity, water and sanitation, these are all goals, and we all think that there are very critical linkages with health that need to be explored and lead to intersectoral action in the next 15 years.
Okay. Faraday, let me come to you here. You're a strong advocate for citizen-led accountability. Talk about the accountability aspect of the SDGs. What are your concerns?
My concerns are that we need to involve citizens in accountability. Through our efforts as White-Ribbon Alliance, we've learned that when citizens are engaged, they can, through their voice, demand and hold leaders accountable. We need to open up spaces for citizens to engage and also invest more in citizen-led accountability. We've seen through our citizens' hearings held in over 30 countries with our partners that when citizens are engaged, they can hold their leaders accountable. Citizens have been able to raise their voice. They've given us what they want the governments to focus on and how they should be involved in accountability processes. All these hearings have happened in over 30 countries, like I told you, and we've engaged over 400 organizations, individuals, citizens, including adolescents, and all these have been given a platform to tell their governments what they want and how they want to be involved in holding their leaders accountable. We've seen progress. We've been able to take the hearings to our health ministers and also our prime minister, and all of them have welcomed citizen engagement. As you can see, there's already greater support and ownership of the new development agenda. And all we're asking for is to ensure that citizens participate and hold their leaders accountable. And we say that there should be nothing about citizens without citizens.
Sounds like there's far more engagement than there was in the development of the Millennium Development Goals. All right, you have 2 questions from our viewers. Yes, I'm afraid so, Tim. So the first one, could you provide more detail on the global framework for impact? Faraday, pass it to one of the men.
So I'm not sure what the global framework for impact is, but I think it's referred to the framework for monitoring progress and accountability related to the Sustainable Development Goals. Would that be a good guess? If that's the case, then that is still very much under development, and a lot of discussion around what are the indicators we can use to monitor it. How can we create something that really resonates with the world, where policymakers, people can understand whether our planet is getting healthier, whether people's well-being is improving. And then, of course, there is the whole issue around accountability. How are all the stakeholders going to be involved? What about transparency? So a lot of discussion going on right now around the SDG monitoring agenda. And in the end, I guess that refers to the global framework for impact.
So a lot of work to do between now and September. Tim, while I have you here, can you talk about the financing aspect of this? For the SDGs, are we talking more about a global financing or national financing? Give me some help here.
So I think the SDGs really are, over the next 15 years, looking at a major change in the landscape of financing for health development and for development in general. I think a lot of countries are going to move from low income to middle income status over that 15-year period. And in that context, traditional forms of development assistance like grants will no longer be appropriate for countries that are middle income. And so people are starting to think now, in the context of the SDGs, how to anticipate and embrace that transition. And that means we have to put, first and foremost, a lot more attention on domestic resources. Domestic resources in terms of public sector, government expenditure, raising money through taxes and other forms, but also through the private sector. And in fact, we know that in most countries now, even low-income countries, government and private sector are usually the majority financier of their health sector. But we know that there's also a very concerning situation that we've seen in the context of the MDGs, which is when more development assistance goes in, government contributions to the sector go down. It's what we call substitution. And so I think in the moving forward in the SDG and the financing for development framework, we'll be really looking at how development assistance can become additional to domestic resources, and that development assistance can catalyze the growth of domestic resources such that by 2030, many countries will be able to sustain the financing of their own health systems.
And that's really going to be a lot of the discussion in July in Addis, isn't it?
It is. And in the health sector, we've got a long way to go, because at the moment, the majority way in which we finance health systems is by asking people, citizens, to pay at the point of service. And this discourages people who need services from accessing care. But if they happen to pay, it's a major source of impoverishment. And approximately 100 million people per year fall into poverty because of payments for health care. So if the SDGs are going to be successful, and we're going to eliminate extreme poverty, and we're really going to ensure universal access to services, we have to change not only the level of financing, but also the way in which health services are financed, so that people don't pay at the point of service.
You know, the MDGs seem challenging at the beginning, and listening to this, it seems like this is going to be even harder. Faraday, let me ask you one last question. What is your advice on the best way that we can hold governments accountable when it comes to the SDGs?
I'll still insist or emphasize citizen-led accountability. Without citizens, we can't achieve more. We know that citizen-led accountability is the fastest and most sustainable way to bring about change. We know that most of the decisions about women and children are being made behind closed doors by men. We want citizens to be involved. When citizens are involved, we'll be able to see results. Thank you.
Thank you so much for what you do. It's really exciting to hear about the power that could hold, and that the voice of the people could make such a difference. Thank you all for joining us. I have to let you go now, but I do thank you for joining us, and I know that it's been a very busy day for you. Thank you so much.
Thank you, Christine. Nice meeting you.
It's very nice to meet you as well. So there you go. Busy days here on day one of the World Health Assembly. That's all we have time for. It goes by so fast when we're having fun, I know. But I do want to thank you for joining us. Be sure to tune in tomorrow. Tomorrow we'll be having the technical briefing on Ebola. However, Committee A will go straight into Ebola, so we will not have those participants on our show tomorrow. We'll have them Wednesday instead. Tomorrow we'll be diving deeper into climate and health. That was Dr. Maria Nera that was here, and she'll be talking about the climate summit that's happening in December and what WHO is doing to help reduce air pollution. Also, we're going to be talking about responding to some severe emergencies. And back by popular demand this year is Dr. Elizabeth Hoff, who is the head of our country office in Syria. She was one of our most popular last year, and she is back at the World Health Assembly. So we'll be talking to her and some of our other experts who are leading in really some work in some amazingly difficult situations right now. But that's all we have for you today. Thanks for watching. I'm Christy Feig from Geneva. We'll see you tomorrow.